And so without further ado, I would like to invite Kim to the stage to set the stage for the day.
Honored guests, respected friends, I want to say that it's both an honor and a joy to be here with you at the 2022 Global Symposium. And I also want to, for the first time, because this is the first time that we've done it, to welcome people to our live stream and to say that we feel you here with us. And it means a lot because we know that a lot of people are up in different time zones, not all of them conducive to watching me give a speech. So thank you. Thank you very much. I'll start by sharing what I feel in my heart right now, and that's gratitude. Gratitude to be in the company of so many people I deeply admire, dear friends, both old and new, from throughout the world. Gratitude to be in the presence of people who are bringing creativity and commitment to the work of overcoming isolation and inequities. Gratitude to be in the presence of people who share a common purpose of bringing more care and compassion to our world. Gratitude to be here with you in this city that I love, Toronto, the place where I grew up. Gratitude for all the hope and possibility I feel in this room. Over the past 5 weeks, I've been traveling to different cities for the launch of my book, On Belonging. And I found myself deep in conversation with many people about a question that's both simple and vast. What does it mean to belong? And I realized, as I paused for a moment, that I've asked most of you in this room that question over the past several years. As many of you know, the book explores stories, studies, ideas that shine light on this question. In essence, building belonging is an experience that's deeply personal to each one of us, something we all know in our own way, in our own being. I feel belonging here with you at this moment, and I hope you feel it too. And I hope that this feeling of belonging will grow more and more over the course of these days we get to share with one another. As you know, the theme for this year's symposium is imagination and action, systems of belonging. We chose these words because imagination is an essential part of the work ahead, and also because imagination is something all too rare in the times in which we are living. Imagination is often the first casualty in times of crisis. In an age of pandemic and climate emergency, extreme polarization, and massive refugee crises, most of us are spending our time playing defense. We're seeking to manage the dilemmas of the day, and we are perhaps understandably lowering our expectations for the future in order to guard our hearts from disappointment. Imagination can seem like luxury in a time of upheaval. Yet we need imagination, especially now. When we can envision a future that's both plausible and positive, we can summon the strength to overcome challenges that might otherwise seem insurmountable. The Reverend Martin Luther King's refrain, "I have a dream," is so ubiquitous that we can sometimes close our minds and lose sight of its imaginal power. He vividly described a world that at the time seemed inconceivable. He was looking ahead, painting a picture in the collective mind's eye, calling forth the energy to pass transformational legislation and to fundamentally shift systems and cultures. That's imagination. The great philosopher Hannah Arendt taught us that imagination is a requirement for building and maintaining a fair and participatory society where people can find belonging. She warned that totalitarian political movements prey on cynicism and the lost sense of creative vision. When people lose the capacity to imagine a better future, they're more likely to cede power to autocrats and violent or exclusionary ideologies. When we can't or won't imagine a better future, we're more willing to hand over control to power-hungry demagogues. It's hard to see the point in exerting ourselves to create a better reality when we can't even picture it. These days, I've been thinking a lot about the question of how we can imagine and build social, political, and economic systems that cultivate belonging. To imagine new and better systems, I know that we need to be clear-eyed about how our current systems fail to honor these principles of connectedness. We all know the state of the world right now. There are more forced migrants fleeing their homes today than any time since the 1940s. Climate-driven megastorms and megafires are forcing unprecedented numbers of people from the places they call home. Young people are facing record levels of depression and anxiety as they search for anchors of connection and meaning in a world of social media. According to Gallup's 2022 Global Emotion Report, upwards of 330 million adults go at least 2 weeks without talking to a friend or family member. 1/5 of all adults don't have a single person they can count on for help. According to research from the consultancy McKinsey, a primary reason why employees are leaving their jobs is a lack of the sense of belonging, especially among people of color. We're seeing the normalization of nativism, xenophobia, and outright racism as authoritarian political movements prey on people's senses of disconnection. This is not a new story. This is an old story. It's a phenomenon that Hannah Arendt described 70 years ago. When people feel a deficit of genuine connectedness, they so often seek to fill it through an inversion of belonging, an obsession with in-groups and out-groups. Toni Morrison called it othering, and the need for a stranger and other in order to defend the estranged self. While COVID could have been an opportunity to wake up to the central importance of remaking social structures to prioritize human connection, this hasn't been the case. We've seen the amplification of disconnection in so many ways, including the extreme isolation of older people in care homes and increases in the unconscionable use of forced chemical restraints and psychiatric medications against their will, and this still continues after COVID. There aren't just policy failures to consider. These are failures of imagination. These are the consequences when we assume that systems cannot change, when we assume that we have to accept inequity, injustice, and disconnection, because that's simply how a human society has always been organized. That's a big assumption. We need to muster the courage to call out failures of imagination and call out systems that are clearly driving isolation. But it is not enough to just tear these systems down. We also need to imagine and build better systems to replace them. Earlier this year, we lost a hero, Dr. Paul Farmer, who passed away unexpectedly at the age of 62. He was also a friend of this movement. While he was known for his expertise in global health, public policy, infectious diseases, and medical anthropology, his greatest expertise was in the art of imagining and building better systems. I first got to know Paul about 20 years ago. It was when I started working in collaboration with Partners in Health, PIH, the organization he co-founded with a group of fellow physicians and activists in 1987. Their stated mission then and now is to bring the benefits of modern medical science to those most in need of them and to serve as an antidote to despair. Over the years, Paul and I shared beautiful conversations that shaped my thinking on a range of topics, from leadership to medicine to the relationship between human beings and nature, to the importance of social connectedness in health. In the days following Paul's death, he was lauded around the world by leaders as a visionary and a global health giant, including presidents of countries and captains of industry. But for me, his biggest lessons pertain to the theme of this symposium. He was a master of imagination and action. After Haiti suffered a devastating earthquake in 2010, hundreds of thousands of people were without the basic necessities of food or water, let alone health care. As the country was still just clearing the rubble, PIH and its Haitian affiliates built a state-of-the-art 300-bed university hospital as a way not only to provide needed medical capacity, but also as a means of training a new generation of local healthcare professionals. Paul insisted on giving the name University Hospital, even though at the time there was no university there. Nobody could even fathom finding the resources to create a new institution of higher education anytime in the near future. People would point this out to Paul, and he'd simply respond, "Not yet." He would say that the name was a reminder of a very important piece of unfinished business we need to bring to fruition. Some people might call this hopeless idealism, but if you knew Paul, and many of you did, then you know better. This was his imagination. This was his superpower for generating change. Of course, Paul could be a fierce critic. He would often point out that leaders of important financial and medical institutions have become resigned to the idea that conditions of disease and limited health access wouldn't ultimately improve conditions for the world's poor. The prevalence of this thinking, he said, was not only an injustice. In his words, it was a failure of imagination. Yet, he didn't just rail against these failures. He focused his energies on building vastly better systems in partnership with people who lived in conditions of poverty. When I think of a system of belonging, I think of the system of care that Paul played a central role in creating and cultivating. It's called accompaniment. The idea of accompaniment is to transform healthcare in low-income settings from an impersonal form of service protection and provision into a long-term relationship of warmth and even interdependence. I would add, based on caring and compassion. Partners in Health has been implementing the idea for decades, training local community workers called CHWs, who conduct home visits, teach preventive healthcare skills, making case findings for medical providers, and constantly checking in on people with specific needs, including young children, pregnant women, orphans, and people with intellectual disabilities. And I'd add that that's really one of the principles of reciprocal care in belonging and in a right to belong, which I'm going to speak about in a minute. It's not about showing up once or twice. It's about showing up all the time and not even being asked. During COVID times, which I know is a bit of a misnomer because COVID will always be with us, but of the crises through the last couple of years, CHWs have served as community contact tracers and offered testing as well as access to vaccines in places where these services have been hard to access, if not impossible. Across different countries, CHWs focus on addressing the interdisciplinary causes of ill health, connecting people not just with medicine, but also nutrition, clean water, housing, transportation, and well-paying work. To accompany someone, Paul once said, is to go somewhere with them, to break bread together, to be present on a journey with a beginning and an end. As he put it, there's an element of mystery and openness. I'll share your fate for a while, and by a while, I don't mean a little while. Accompaniment is much more often about sticking with a task until it's deemed completed by the person being accompanied rather than by the accompagnator. What a radical proposition, honoring mystery and openness in something as prosaic as a professional medical interaction. This is where imagination meets action. 18 years ago, I went with Paul and the PIH team to the opening of the cancer center in their hospital in Butaro, Rwanda. It was the first time I really grasped the idea of accompaniment. Beyond academic or operational plans, I could feel how belonging pervaded this place. I got to know some of the CHWs and how the scope of their work extended far past the remit of what we've typically called healthcare. I remember meeting a man named Jean-Baptiste who was serving as a janitor in the facility. As he walked the land, doing his work, he had this look on his face that marked me. It was this look of poise and grace, a profound sense of duty, self-respect, and love for the people he was serving. In a simple glance, he conveyed to me this poignant sense that the accomplishment of that day was his, too. It belonged to this community and this hospital, and it all belonged to him as well. He was formerly employed as a custodial worker, and yet it was clear that he had a role to play in the provision of medical care at Butaro. Every part of the team mattered, really mattered. A brief encounter with Jean-Baptiste was, for me, a clarification of the meaning of accompaniment as any academic literature or case study, even more. I also want to share that in the last conversation that I had with Paul, I asked him if he knew who, I didn't know his name was Jean-Baptiste, who the person was, and I described him. And I said when we had a couple of hours to sort of wander the grounds while the VIPs were meeting, and I said that I'd taken a picture of this man and we'd had a very brief chat, and he just embodied dignity, and that it reminded me, and still reminds me, that in a place that really has belonging, you could walk up to anyone. It doesn't have to be a head person or in a hospital, the chief surgeon, or so on or so on. It's about in a community, anywhere you are in that community, it's more the relationships and the reciprocity and the trust between people than anything else that they can take out in the world. But even more interesting is when I said that to Paul, he said, "Oh, that's Jean-Baptiste. Oh yeah, I saw him. I saw him the other day in Rwanda, and he's still there," and so on, because I'd sent him the picture I took. And he knew right away. And I bet he knew everyone that worked for PIH, because that's a community. So this wasn't just about the achievement of healthcare, narrowly defined. It was about mobilizing the whole community to take shared ownership over the fullest range of determinants of human health, including, not least, a sense of dignity. As I walked around the grounds at Butaro, contemplating the meaning of accompaniment, I also kept thinking about the physical beauty of the place, not just the verdant, terraced hillsides and striking views of the Virunga Mountains, but also all the care in the design of the buildings. For example, the fact that every patient had direct access to the outdoors. And in my book on belonging, I quote a friend, Dominic Richards, who's like call an architect for belonging, he would say. He's a placemaker. He said to me, you know, Kim, either you design for belonging or you're going to end up with isolation. And I realized then that he wasn't only talking about physical structures, he's talking about everything, even the design of a meeting or a classroom, and how we carry out these principles of respecting one another for who we are, seeing one another for who we are, and that when we tell you who we are, you will believe us and honor that. Almost 2 decades later, in the first months of the pandemic, I mentioned this to Paul in a conversation that we shared. And he said, one of the things that really bothers me and hurts me and pains me is to see the conditions under which the destitute have to take care, he told me. Reflecting on the derelict and dirty clinics and hospitals where he had worked in Haiti and elsewhere from the 1980s onward, he told me how he nurtured a commitment to developing spaces for care that could be inviting, even beautiful, as a matter of respect to patients and as part of the healing process. This was part of Paul's vision of accompaniment. This was a part of breaking bread and being on a journey together. In the face of so many jaded assumptions about what's possible in conditions of poverty, this was the system that he imagined. This is a system of belonging. At our symposium over the coming days, let's honor the memory of Dr. Paul Farmer following his example. Let's call out failures of imagination. Let's dare to envision a better reality. Let's spark action for a more humane world. Today's failures of imagination aren't just our faults as individuals, certainly not. They are reflections of the systems by which we live and by which we are governed. Right now, the avoidance of imagination is woven into the fabric of our political and economic structures. Look to businesses where quarterly reporting requirements drive leaders to prioritize short-term profits over shared long-term prosperity. Look to the whiplash of political campaigns that often hinge on media cycles and monthly fundraising targets. Look to the dominant measurements of social progress, such as GDP, that center on our ability to translate the gifts of nature and human care into raw industrial output that we can track on a near-term balance sheet. We're facing systems that exacerbate isolation, but we can imagine new systems, and we can build new systems. And it's not only Paul's example that proves it. In the days ahead, we'll meet people, all of you, who are also building systems of belonging that address issues such as mental health care, urban design, disability rights, the restoration of sovereignty and traditions among indigenous peoples, and the restoration of land and waters. Imagination is not just about being creative. It's about overturning and remaking the systems that have driven isolation. I humbly state that I would like to begin a revolution, a peaceful revolution, because I believe in peace, but a revolution nonetheless. When we met here in Toronto 3 years ago, hard to believe, for the 2019 Global Symposium, in a world that was so different in so many ways, I talked about an idea, the right to belong. It's the notion that belonging is our birthright. Every person, by virtue of the simple fact that they are born, have an inherent right to belong. What does it mean to realize this right? It means building social, economic, and political systems that prioritize our connectedness in the community and connectedness to vibrant ecosystems, our sense of urgency and shared compassion. It means building systems in healthcare, education, workplaces, the arts, correctional facilities, agriculture, and many other spheres that enshrine dignity and respect. It means doing all of this in our neighborhoods, too. People have been thinking about how to build systems of belonging since time immemorial. More than 2 centuries ago, William Blake talked about the city of imagination, a utopian vision of London that reflected the highest human values, a place where we all belong. Today, it's clearer than ever that we need to apply our imagination to realize the right to belong for our collective well-being, our health in all regards, looking at how to honor the ancestors, the past generations, how to ensure a world that our children and grandchildren and great-grandchildren and on can thrive in, to preserve our democracies, and for building equitable economics, for saving our shared future. Only that. Belonging is a thread that connects so many vital movements in our world. When Paul Farmer and his colleagues talked of a right to health and a preferential treatment for the poor in the 1980s, it sounded like starry-eyed idealism to some. But they've proven beyond a shadow of a doubt that these ideals can be achieved. As we begin our symposium, let's each reflect on what we can do to make the right to belong a reality. As we go forth into our work, let's show that it can be achieved. This symposium is not about experts and listeners, leaders and followers. It's not me telling you how to build belonging in your life and your community. It's not telling you how to do anything. Each one of us is here because we know what it means to build belonging in our own particular context. Each one of us is here because we have a piece of the overall solution. A few years ago, when I traveled to Kentucky to interview the great farmer, poet, philosopher, Wendell Berry, he gave me a simple yet profound piece of advice. Don't be prescriptive. In other words, don't tell people what they should do. Don't tell people how they should build belonging in their own communities and lives, because that would take away the call to imagination. So let's bring our practical knowledge here and also our deepest felt sense of what it means to belong, because we all know, we all feel it. Let's bring the specific lessons we've learned in our lives and also our wildest hopes for a radically more humane future. Let's bring our systemic thinking to bear, but not without our imagination. Thank you for listening.